Good afternoon, everyone. Welcome to this edition of the Hindu Wellness Webinar, organized jointly with GSK. Today's webinar is on shingles, the disease, its impact, and its prevention. It is the World Immunization Week, and shingles and its awareness and prevention we're taking it forward from here. The goal of World Immunization Week is for more children, adults, and their communities to be protected from vaccine-preventable diseases, allowing them to live happier and healthier lives. For over 200 years, vaccines have protected us against diseases that threaten lives and prohibit our development. With their help, we can progress without the burden of diseases like smallpox and polio, which cost humanity hundreds of millions of lives. In India, adult immunization is yet to become a part of mainstream health conversation. Many adults do not understand the importance of vaccination in their different stages of life. So here we have with us two doctors, dermatologist and a physician, who will explain to us what shingles is and how we can take care of ourselves. We have with us Dr. Antionetta Ashwini J, who is a dermatologist in Nagar, Chennai, and has an experience of 12 years in the field. Dr. Ashwini practices at Apollo Medical Centre in Nagar, Chennai, and Apollo Health Center in Greaves Road, also in Chennai. The doctor completed her MBBS from Sri Ramachandra Medical College in 2011 and her MD in dermatology, venereology, and leprosy from SRMC in 2015. She is a member of the Tamil Nadu Medical Council and the Indian Association of Dermatologists, Venereologists, and Leprologists. Some of the services that she provides are treatment for acne, pimple scars, permanent acne solution, keloid, scar treatment, skin allergy treatment, etc. Welcome, Dr. Ashwini. We have with us Dr. Ashwin Karuppan, consulting physician and diabetologist at Gleneagles Global Hospitals and at Tambaram Medical Centre, Chennai. He holds a postgraduate diploma in diabetology from Boston University, USA, and PG diploma in cardiology. After his MBBS and MD in internal medicine, he is the founding member of Tambaram Foundation, which is a self-funded charitable organization, and is also an investigator in clinical studies and trials in diabetology. He is an invited member across continuing medical education programs and conferences. Welcome, Dr. Ashwin.
Thank you.
I'll start the first question by asking what is shingles? And frankly, the other word for shingles is even more difficult. It is herpes zoster. But can you tell us what shingles is and how it actually creates problems for adults? Would you like to answer this question, Dr. Ashwin?
Yes. So shingles is caused by a group of virus which is called herpes zoster virus. It is like, we have all had chickenpox. At least 90 to 95% of the whole population have chickenpox. It's a kind of virus which gets into the body, produces a lot of blisters during our young age group. And then it continues to stay dormant in our nerve roots. And it then later on, it activates as shingle, or we see most of the time a single dermatome rash, especially in elderly patients. You can also see in many cases where we call it as a sore, cold sore, where you can also see it has herpes labialis. It can also present somewhere in the body, in the torso. It can also present somewhere in the face. And once it disappears, probably 4 to 5 weeks, you can see that there is an excruciating pain which happens. So that is why it gains a lot of prominence, because it causes prolonged herpetic neuralgia, which becomes a major problem for the patient, and they continue to get treated for those from the neurologist, the diabetologist, and the dermatologist for quite a long time. So shingles has been one of the major concern, or at least 1 in 3 adults definitely will get shingles, and the prevalence after COVID has been more than 50% of the people, especially due to the extensive use of steroids and the loss of immunity. We see a lot of this, which was not preventable before, but now vaccination has taken over and it has done a great one of the best inventions in mankind is vaccination, where you can prevent a lot of disease. I think shingles is one of them right now. And I think it's very important to know about the signs and symptoms, and it can affect in any age group at any point of time.
Dr. Ashwini, can you tell us how common it is? I mean, we understand that people do get shingles and that after post-COVID, the instances are higher. But how common is it? I mean, like this seems to be a new term to a lot of us. And who are the people who could be at risk?
So herpes zoster, otherwise called shingles, or in local language called akki, is actually very common. And we see a lot of patients with zoster in my practice. They are not aware of what it is, or they are only aware of the colloquial term as akki. So they come in with a rash, a fluid-filled rash over one specific area. For some people, it is painful. So for some people, it is not painful. But pain is a very, very, prominent feature of zoster. And the pain can continue even after the rashes subside. So in zoster, how does it start is the rash doesn't come initially. First, they'll have a sensation of pain or a tingling sensation or a sensation to itch or an increased sensitivity in that specific area. So there won't be a rash. This is how it starts. And eventually it will progress to developing fluid-filled lesions over only clustered. It's clustered only to that specific area, and then starts the pain. The pain is really excruciating. They compare it to labor pain. I don't know how far that is true, but then it is quite painful is what I've heard from patients. It is very common in the older age group in comparison to the younger age group, but it's not that it's not occurred in the younger age group, but it's very rare in the younger individuals, mostly seen in older individuals and also in people who have comorbid conditions like your diabetes or asthmatics or anyone with any chronic disease. So they are the ones who have to be extra careful. Any malignancy, patients with any HIV or AIDS or any state that's immunocompromised, where their immunity is a little low, they are more prone to the zoster infection.
So I have a question here. What are the complications because of shingles? I mean, a patient could have because of shingles.
See, the first and foremost complication is your pain. It's called post-herpetic neuralgia. So there is pain when you're having the rash, but that eventually goes away for most of the patients. If the pain, continues for more than 90 days, it goes into a state called post-herpetic neuralgia, where the patient has excruciating pain. Like I said, they're very sensitive to the touch. Even simple things like if breeze falls on their skin, even that is painful for them. So in a normal person, that is not pain-inducing. Wind blowing onto the skin is not pain-inducing. Whereas a person who has post-herpetic neuralgia can experience such uneasiness, and that is one of the most common complications of zoster. Apart from that, zoster can occur over the eyes. It's called herpes zoster ophthalmicus. It can happen inside the ear. It's called oticus, where they can have something called the facial palsy. It can affect the spinal nerves. It can also affect the the spinal nerves can get affected, causing muscle weakness, causing after muscle weakness, the bladder can also get a little weak because of it. So all these are the very known complications. It can also cause stroke. It can affect the brain. So yeah, if it's not treated at the right time, there are a lot of complications. But the most important complication which I want to put across is the pain.
Dr. Ashwin, you were talking about vaccination. And would you like to explain this part about vaccination, how it helps to prevent shingles?
Previously, we do not have a very well-known vaccine for the whole herpes group. We only had vaccination for chicken pox, which is available for the current generation. Maybe for the past 5-10 years, we have got this chicken pox vaccination. But now, today, we have a vaccination which can take care of the whole group of herpes, which can also produce chicken pox, which can also produce the varicella zoster. So how does this vaccine actually helps? See, all vaccines have a kind of antibody or an antigen which actually induces immunity. So it's a conjugate vaccine which is available to everyone today, and it is being administered by various governments across the Western countries. And now it is a kind of new and getting to one of the largest populated countries in the world, where prevention of disease plays a vital role rather than treating it. That is what we all have experienced, especially during the COVID pandemic. So this vaccine, it can be taken by anyone, irrespective of whether they have got chickenpox at a younger age group or not. So you don't have to worry about whether some people do not even remember whether they got chickenpox or not. So I think any of this who has got a pox, or who have already been affected by some kind of herpes zoster virus, like herpes radialis, ophthalmicus, and as Dr. Ashwini said, it can be any form. It just depends upon the name, just varies depending upon the site it produces the disease. So I think any of us in our lifetime, if we have got, then you can get vaccinated. Usually it can be done in 2 doses, which would be very effective, and it is found to have prevented 90% of the infection recurrence. So we have all got the virus in our body some way or the other, but it remains dormant. It gets activated when your immunity goes lower and lower as the age progresses. Keeping that in mind, now coming to what kind of population actually can get this vaccination done. The first thing is anyone above 50 years old is eligible to get the vaccination. Anyone between the age of 19 and up to 50 years old who has got a comorbid condition, to say there is a type 1 diabetes patient, there is a patient who is on steroids for some reason, whether it's an autoimmune disease, whether they have diabetes, they are young cardiac patients, whether they have any other comorbid conditions like asthma, they have COPD, any of these chronic disease patients can be vaccinated. According to the National Immunization Schedule, which is being given by the CDC, they have clearly stated that anyone above the 50 years of age group need to take this vaccine irrespective of their previous infective status. So that is what is being practiced and followed throughout the world, and that is what we also need to practice. Here in our country, we think that vaccinations are only for children. We don't know there is an adult vaccination schedule where post the childhood, we also need to take certain vaccinations for these kind of diseases, which needs to be emphasized in our current population. And one of the best vaccines we have currently available post-COVID, and in this particular era where infections are rampant and are very expensive to treat, I think vaccination provides a complete protection from all these kind of diseases which occurs. And especially when it comes to shingles, as I told you, 90 to 90%, 95% of us are affected with shingles. And when it comes to diabetic patients, the complications are enormous. And sometimes we also have to do some, no kind of block or something actually to get the pain. It's so painful. And as Dr. Ashwini rightly pointed out, they even, some females, they even refer to this as a labor pain. Some people will also refer it to as like pouring a boiling hot water. I think today we have a chance to take that step forward by vaccinating ourselves.
So, doctor, here somebody called Nandini Rao, she's asked a question. Can someone who has been vaccinated for chickenpox get shingles?
Yes, that is what the literature says. People who are vaccinated for chickenpox can still get shingles. Because when you have a shingle, when you have a herpes zoster, the virus is quite different originating and probably it has mutations. We have seen this multiple times in COVID as well. So if you can see in COVID, we were all vaccinated, but still we continue to get different variants of COVID. So we need a vaccine which can completely provide a coverage, which includes chickenpox and zosters and all together. So I think it is a vaccine for the whole group of herpes.
So, one of the listeners called Pratima, she wants to know if the vaccine is available in India. Would you like to take this question, Dr. Ashwini?
Yes, Pratima, yes, we are lucky enough that the Indian government has approved of a vaccine which is yet to be released. So that's good news for us. It is very important for us for this approval. Why? Because the population of India, and we see so many cases of zoster in India, and so many cases go unreported as well because of lack of awareness. So hopefully through this webinar and through general awareness, people are more aware that of this vaccine, and they should get these vaccines taken at the earliest.
Doctor, here's another question for you. Is this disease communicable?
Of course, yes, it is a communicable disease. It can spread faster. That is why when you have herpes zoster, or rightly pointed out in the colloquial term, which we call agi, when you have certain things, we ask them to always wash their clothes separately. We ask them to make sure that it doesn't gets mixed with other people, because it's a highly contagious virus. So it can occur to anyone at any point of time, and it can enter the body and produce the disease. And it is a similar like chickenpox. It also produces chickenpox. So we all have a kind of history of having chickenpox within our families, and we know how contagious it is. Why we don't allow them to go outside, and what is more important is like isolation of the patient, and it can rapidly spread faster. And it is highly contagious disease, and that is why we need a vaccine which can prevent it.
If I may add on,
yes, ma'am.
Any patient that comes to me and with zoster, strict isolation and bed rest is advised, and avoid to come in contact to any age group that is susceptible, like younger children and older adults. Reason being, it is contagious. So once the scab forms, it's not very contagious, but the fluid-filled lesions, when they have the clustered fluid-filled lesions on their body, it is contagious. So we ask them to isolate themselves and take good rest and drink plenty of water. So these are the general advices given. So the answer to your question is yes, it is contagious.
Right. Here's an anonymous attendee again, and he wants to know, anyone who has had shingles recently, can they be vaccinated? Is there any time frame for this?
Usually, anybody who has shingles can be vaccinated. We say that whenever you have a kind of active infection, or whatever that might be, for example, you're undergoing a sepsis, or you're having a current fever, you're having any kind of active infection of shingles, then you cannot get vaccinated. You have to wait for 2 weeks or so for it to get subsided and then go on and get vaccinated. Apart from that, minor cold, cough without fever or any other allergic symptoms, there is no contraindication at all to get vaccinated. And this vaccine cannot be used in pregnant women. Other than that, all the other age groups can have this vaccination at any point of time, provided they do not have an active illness which is ongoing.
Here is a question: for how long does shingles happen? I think they're asking what is the time frame, how many days or how many weeks?
It's very subjective. Why? Because each patient reacts to the infection quite differently. A few patients resolve, their entire lesion resolves within 2 weeks. Some patient can take up to 6 weeks. If the zoster gets secondarily infected, it can take even longer. So you cannot give a hard and fast time frame, but it's around 2 to 6 weeks.
2 to 6 weeks. Okay. So does shingles, does it cause any hurdles to daily life? I think you've answered your 2 to 6 weeks. That means, and you have to be isolated.
See, isolation is only until the fluid-filled lesions are there. Once it dries up and forms a scab, you're good to go.
Can it happen? Okay, what age group does it occur? You did say about the age of 50, but can it happen in people who are between 15 and 50 also?
See, shingles as such doesn't have any specific age group. We have seen shingles as young as 10 years. We have seen shingles as old as 90 years. And that is why it's very quite important for us to prevent this disease rather than treating it, because it's very easy for us to prevent it rather than treating the disease. The second thing is like when it comes, it can occur in different forms. As I told you, it can be a very minimal form where you just get a herpes labialis. We call it cold sore. We always feel that it is due to medicines that you have something on the lips when you have a cold. Probably you feel that by taking medicines you have some kind of lip related sore. But actually it's a herpes. It's a kind of virus. The same way during this winter season, we see that there is a lot of reactivation of these viruses. One reason is because we know that the virus basically gets reactivated faster. And that is why we have a lot of flu and all these things during the winter season. So we see a lot of that. And even in the summer season, we see a lot of chicken pox. I think now we are right now going through the summer season.
Yeah.
So I think it's a very obvious topic to be spoken at this moment. We can try and prevent some of those infections which can occur. I think so during the summer season, the chicken pox is also quite evident. So I think that the spread is much faster because of the excess sweating, the humid climate, and I think India is one of the tropical countries where apart from the Western world, where we have a lot of data which suggests that we are more prone to get shingles than any other countries. So I think that there is no particular age group, but yes, definitely there is a lot of it can affect anyone and at any point of time in their life.
Thank you, sir. So here is somebody, they haven't given their name, but how is it different from chicken pox and is it harmful? Does it have side effects? What are the side effects of shingles?
So when it comes to chicken pox and when it comes to shingles, always the Varicella zoster and the herpes zoster, the terminology is almost interchangeable. What happens is usually chicken pox is widespread and it usually occurs in young population. We see most of that during the young population where it is widespread and it is like almost systemic. You can see the pustules occurring everywhere throughout the body.
Yeah.
Whereas when it comes to a zoster infection, what usually happens is it's only a particular dermatome. That is a very classical sign that we can see. It doesn't affect throughout the body. They sometimes say most likely in the torso, where females they wear the clothes or near the sari level or near the pant button level. You can see a very typical rash. As Dr. Ashwini rightly pointed out, it usually starts like a kind of pain, a nagging pain, which will become burning in sensation. Probably they will think that they have fallen somewhere, or they will think that they got hit somewhere or some kind of injury. They will be roaming around with the orthopedician and all of that. And suddenly they see a kind of blisters, which might be very classical. And that is where they come and see the dermatologist in most of the cases. And they diagnose this has to be herpes zoster. So I think the prodromal phase, that means before the disease actually occurs, starts maybe a week before. And then after a week only we can see the pustules which are occurring, which continues to stay there up to 2 to 3 weeks normally. Sometimes it can extend up to 6 weeks as Dr. Ashwin said. So I think that is how it is. This is a very specific selected lesion which is occurring from that of a chicken pox which is widespread.
Okay,
If
so,
I may add on,
yes, ma'am.
if I may add on, chickenpox is not painful.
It's not painful.
Yeah.
Okay.
So you will have fever, cough, body pains, and all of that in younger kids. Even in adults, they can get it, but it's not painful. Whereas zoster is really painful. So pain is the defining factor for zoster.
Oh, okay. So the other thing is, does lifestyle impact on having shingles? I think I didn't get the meaning of this, but if you have understood, please
I
go
can.
ahead and answer.
Yeah. So there's something called quality of life, and it is affected for a person who has shingles. Why is quality of life important? So as I said, the pain, the inability to do regular work, or inability to go to work, the inability to do anything by themselves due to the
Okay.
excruciating pain will affect a person's quality of life. So yes, shingles has a role, and people eventually get into depression. So like I said, so the causes of zoster are multiple, known causes are multiple, but the unknown is stress. So you cannot quantify stress for anybody. So stress is a factor that plays a huge role also in zoster.
Okay. So it could be stress that's actually manifesting as herpes zoster,
It
or
can
it's
be a
activating
cause.
this
It
virus to
can be
come.
a cause. Yeah, it can be a cause to reactivate the zoster.
Wow. Okay. And there's somebody called Raghothaman K, and I think they are speaking it for somebody else. So my husband is affected recently and the eye has been affected. Any specific advice?
See, when it comes to, I think that most likely she's talking about herpes ophthalmicus, which is very common to affect the eyesight and the eye and the nerves which go through the eye. So I think in her case, in most of these cases, there are two things which will happen. The first thing is the eyesight, whether it is actually taken a toll on the optic nerve, which is connected to the brain for the eyesight. That you need to check with the ophthalmologist to see that there is no residual effect. That is number one. The second thing is the dryness, which is very, very common we see. So the eye becomes dry, it becomes very irritation. Thereby, it will scars the cornea. So I think that we need to continue to use, some kind of artificial tears.
Yes.
So that the eye continues to stay lubricated. That is extremely important. In most of these zoster cases, if you can see, the idea is not about starting an antiviral, because by the time you start an antiviral, the virus is already producing its disease. So you're not limiting anything. They say that the moment you start an antiviral, it's only going to bring down the load, but it's not going to, it can also bring down the time frame of the infection, but it's not going to prevent the infection from further effects. So that is one. So in this case, what I would suggest is probably meet a good ophthalmologist, get your eyesight checked to see if there is any residual effect. If you are a diabetic, probably looking at the name, I assume that they are quite a generation older. So if you have diabetes or any other comorbid condition, get yourself under control, and probably once you get better from this illness and recover completely, go and get vaccinated so that it doesn't react.
Thank you, doctor. So here is somebody called Jayamani, J. Jayamani, who says, what is the treatment for post herpes zoster neuralgia? Is there a treatment for it?
Yes. How do we treat post-herpetic neuralgia? There are two kinds of treatment what we do. The first one is it occurs and stays there for 90 days, as Dr. Ashwini rightly pointed out. If it continues to further, that means it becomes a chronic pain syndrome. That means it's a post-herpetic neuralgia where there is a constant pain for the patient throughout the lifetime. And some people, they really suffer, as Doc has pointed out clearly. Even blowing air in their face can produce a terrible pain. And you can see most of these patients are covering their faces with a cloth or something, half of the face. So in those cases, we use something called as pregabalin, we use something called as carbamazepine, and this is most likely to be treated by a neurologist or an internal medicine consultant or probably the dermatologist. So what happens is we give a pain modulator. It blocks the pain receptors throughout the body and then it produces some kind of comfort to the patient. So that is one. The second thing, in worst case scenarios, sometimes we can also use Botox. We can also use a pain management and see where the particular nerve is. And we can also inject an injection to disconnect that nerve sensation and we can give relief to the patient. I think that kind of block treatment is also available. So I think these are the major treatments which are available for pain. And most of these patients, 90% of the patients do get better by treatment with drugs. And 10% of the patient continues to have the pain for a chronic time and they might need some kind of intervention and pain management, which can be surgically done.
If
So,
I may add on.
Yes, ma'am.
Yeah. So most of my patients, some of them are affordable, some of them are not. So one of the basic home remedies that I give them is ice fermentation over the area that there's pain. So it can numb the area. It's a very simple but very temporary, very temporary relief. But in my opinion, something is better than nothing. Some people are very reluctant to take treatment on a long-term basis. So like Dr. Ashwin has mentioned, we either try to work on blocking the nerve or, giving Botox to help the patient better. There is no one-stop solution to this, but it's more of a long-term treatment option that we have to keep in mind for the patient. And in some patients, I have also noticed with time, the pain reduces. So it's not something that it will be there lifelong, but with time, I have seen a decline in the pain, but that also we cannot give a hard and fast rule that, okay, your pain will stay for 3 months and it will reduce. No, that is something we don't know, but with time, it does reduce.
Okay. So, ma'am, here's a question. What is the relation between hygiene and shingles? I mean, a person who is unhygienic, is he or she prone to get shingles, or is it just that it happens despite you being very clean habits?
It just happens. Hygiene is a plus point. So if you're hygienic, it's good, but it can happen either way. So the more comorbids, that is, the more things we see in patients is old age. So in old age, in patients with already pre-existing conditions like diabetes or asthma, you can't pinpoint to hygiene as such, but reduced immunity can cause or reactivate the virus.
So there are quite a few repeat questions here. So it's like, what is the difference between a regular rash and shingles rash?
Meet a dermatologist.
Okay. And then which body parts get infected?
Any body part can get infected. So there is no hard and fast rule that only this body part or that body part can get affected or most commonly affected. Any body part in herpes zoster can get infected, but it is something, so like me and Dr. Ashwin have already discussed, it normally sticks to one area. Okay, so it only sticks to one area. And the beauty of herpes zoster is it never crosses the midline. Okay, so if you cut your body into two, the zoster will not cross over to the other side. So if it's on the left side, it sticks to the left side. And if it's on the right side, it sticks to the right side 99% of the time. So when a patient is very immunocompromised, as in the immunity is really low, like your HIV or any malignancies, what happens is we have seen patients with disseminated herpes zoster where it occurs all over the body. So they might need admission, hospital admission. So that is something I don't think we have touched upon. But yeah, so when your immunity is really low, it goes multi-dermatomal. So you'll have multiple areas that are infected. So you cannot say only this for this kind of a person, it'll only occur in this area. We can't say that.
Right. And ma'am, when we are on this, is there a chance of relapse? Suppose somebody has already had it. Is there a chance of a relapse and could it be fatal?
Chances of relapse, yes. Fatal is very subjective. It differs from patient to patient. Most of the time, it's not fatal, but the complications post-zoster can be fatal. As bad as, the ophthalmicus, the herpes zoster ophthalmicus, you can have loss of vision. So,
Okay, because it affects your cornea or your retina.
exactly, and the cornea is very important. So, loss of vision is bad. So maybe it's not fatal. There's no what do you say, danger to life, but losing eyesight is
Okay.
bad.
Thank you, ma'am. So here is one person, Pratipal Madan. He says, I suffered herpes zoster infection in March 2022. My left eye and the face left side was affected. I still have intense pain. I want to know how long it lasts.
Usually, as I pointed out, it can last 90 days or more. And we have seen people who have been developing this kind of pain. I think in his case, it looks more likely like an trigeminal neuralgia, which is being caused by the herpes. And I think when you have a trigeminal neuralgia, which is lasting for more than 90 days, most likely it requires a kind of combined combination of a drug intervention or probably a selective nerve block. I think that is what is going to give him relief. The second thing is I think he is an ideal candidate who needs to get vaccinated so that it doesn't repeat itself somewhere else in the body. So I think that is the point number 2. So in his case, if drugs are not giving adequate control, I think it's better for us to go ahead and consult a dermatologist or probably a neurologist and see how bad the nerves are affected. Because I have seen patients who have been suffering from this disease for 25 to 30 years. And where they continue to take a lot of these medications, painkillers, and as the age progresses, I only feel that the pain continues to worsen and gets to its climax. So I think most of the cases, if it doesn't get better after 6 months to 1 year, I would always suggest a patient going for a nerve block so that they get a permanent relief. And as Dr. Ashwin rightly pointed out, it's a psychological factor. It really puts people in depression. We have seen many patients who are completely depressed because they are not getting rid of the pain. And it's quite a nagging pain throughout the day, throughout the night, sleepless nights. And it gets aggravated when you are extremely stressed, when you have an adjoining infection. So I think that as rightly the whole system of this core of this particular seminar is all about the vaccination week. So we all need to talk about the importance of vaccination, how you actually prevent these diseases. And this has happened to somebody else who's right now asking views. I think we have an opportunity to prevent this disease.
Here, doctor, there's a question. How do I protect my elders, people who are above 50 years, and convince them for a consultation? I think, so my question is also, suppose somebody is 50, they've never had this issue of having shingles. Why would I even think of going to a doctor? I mean, you just can't tell somebody randomly you might get shingles, so go get yourself consult a doctor. Would it even work?
To this question, what I would suggest is, it is just like a road traffic accident or wearing a seatbelt. We all travel in a flight. We all travel day to day outside. And why do we wear a helmet? Why do we wear a seatbelt? Or why do we even have wear a seatbelt in the flight? Right? So it doesn't matter that the flight accidents happen once in a year or probably once in 10 years. But still we continue to take the precaution. So now we have come to an era where we are talking about prevention of the disease, not waiting for it to come and chase us down. So as I told you, 90% of us have been affected by chickenpox already, and we have the virus dormant in our body, which can get reactivated at any point of time. So anyone above the 50 years of age group says that fine. So you're having a comorbid condition. Probably you should try and prevent the disease. So it is just like your seatbelt or the helmet. If it happens, it's going to prevent you. If not, you have nothing to lose, but just prevent the disease and stay healthy.
So one attendant question, you're talking about vaccination. Would it be like flu vaccine? You have to take it annually or once in 2 years, or how does it work to prevent shingles?
If you see, the flu vaccine continues to be given round the year because virus has the sense of mutation. As long as it has a susceptible host, it's going to continue to mutate. If you can see in this particular season, during the December time, we had a lot of flu. We had a lot of flu than what we had 3 years ago. One reason is probably there was a continuous mutation of virus. That time, during when we are all in the lockdown, there was no susceptible host because we never went out. We wore our masks, we washed our hands, and we continue to fly off all of that once the COVID is done. We decided that there's no more. So the flu started to come. The same way, when it comes to shingles, it's a very simple concept that you have one vaccination and probably a booster dose later, which is going to protect you for the rest of your life. That is 10 years or 12 years from now. So I think it is not going to be the mutation which is constantly going to be there, and every now and then you're not going to tell you just like COVID, you take the booster dose, you take another dose, and it keeps going round and round. And maybe we end up with hundreds of doses of vaccine. It's not that. This is a vaccine which is being produced and which is being time tested, and it has a lot of data which supports that once you take this vaccine, you're going to be immune for the rest of your life. At least 90% of these infections are not going to, you might get the infection, but it's not going to be that severe. So I think vaccines are all about blunting the severity and making it acceptable to human mankind, and probably not taking it further to the next level. And that is why we are all sitting here right now, just ignoring all the COVID protocols because we are all vaccinated.
Thank you, doctors. Thank you so much. It has been such a fruitful session and very interesting. We've had a long conversation on just one topic on shingles and how difficult it can be. People who have had shingles don't know how difficult and painful it is. Thank you very much for your time, doctors.
Thank you so
Thank
much.
you.
And if there are any personal questions, we would just forward it to you if they want to consult with you.
It'll be a
Thank
pleasure.
you very much.
Thank you so much, Sujata.
Thank you so much, Mrs. Sujata, and thank you all the audience, the Hindu and the GSK for providing us this opportunity. I think it's a great educational session. Thank you so much.
Thank you, sir.
Thank you so much.